بسم الله الرحمن الرحيم. Today we will start to study together the reproductive system, الجهاز التناسلي. The reproductive system is formed of two parts. We have male reproductive system with its parts, and also we have the female reproductive system. Starting with the male reproductive system. The male reproductive system is formed of many parts. Number one, what is called the primary sex organ or primary sex gland, which include the testes. The testes are responsible for two functions. Number one, secretory function, that the testis secretes a very important hormone which is called the testosterone hormone, which is responsible for the male sexual characters. And also the second important function is that it is the site of formation of sperms. So the testis is considered as the primary sex organ or gland. Number two, a group of structures called the secondary accessory organs or the secondary sex organs, which are formed of a group of glands secrete multiple secretions for the nutrition of the sperms, and also canal system or duct system for transportation of the sperms which are formed in the testis to the outside to reach to the female. Thirdly, the last part of the male reproductive system is the copulatory organ, عضو الجماع, which is the penis, which transmits the sperms to the female genital system. Starting the testis. The testis, as we said before, it is considered as the primary male sex gland. The number of testes are two testes. The position or the site of the testis, it is present in the scrotum, which is nothing but a pouch of the skin, projects from the lower part of the anterior abdominal wall, and the scrotum is divided. The scrotum is divided into two compartments by an incomplete septum. Each compartment contains one testis and also some other structures like the epididymis and the lower part of the somatic cord. As regards dimensions or the size of the testis is 4 centimeters in length and 2 centimeters in width or breadth and 1 centimeter in thickness. So it is 4 by 2 by 1 centimeters. As regards the structure of the testis, the testis is surrounded from outside by a very thick and dense fibrous capsule called the tunica albuginea, which sends multiple fibrous strands inside the tissue of the testis, divide the testis into about 30 to 40 chambers, and each chamber of these 30 to 40 chambers contain 2 or 3 seminiferous tubules, small tubules, and the sperms are formed within these seminiferous tubules. The sperms which are formed within each compartment of the testis are collected and arise from this compartment by small ductules, which unite together to form a large duct arises from the upper posterior part of the testis to form what is called the epididymis, اللي هو باللغة العربية اسمه البربخ. So the epididymis is the final result of the union of all the ducts arising from all the chambers of the testes. The length of the epididymis is about 6 meters in length, and this duct is coiled or convoluted upon itself, so it is transformed into a small structure which has 3 parts. The upper part is called the head, the middle large part is called the body, and the lower part is called the tail. And the tail continues lower down in the form of a duct called the vas deferens. The vas deferens, as we said, is considered as the downward continuation of the tail of the uterus, which arises from the scrotum and passes to the pelvic cavity. It enters the pelvic cavity through an opening which is present in the abdominal aspect of the scrotum and passes medially and behind the urinary bladder. Here, in this region, on the medial aspect of the vas deferens, there is a gland called the seminal vesicle, which secretes a secretion responsible for nutrition of the sperms, and its duct joins the duct of the vas deferens, and together forming the ejaculatory duct, which opens in the upper part or prostatic part of the urethra. So again, the seminal vesicle is considered as pyriform sacculated pouch or gland, which is present opposite the posterior aspect of the urinary bladder on the lateral aspect of the vas. And its duct, as we said before, unite with the vas to form the ejaculatory duct, and its secretion is responsible for nutrition of the sperms. Now, the ejaculatory duct opens in the upper part of the male urethra, or what is called the prostatic urethra, and this part of the urethra is surrounded by a very important gland called the prostate gland. The prostate gland is nothing but conical, fibromuscular, and glandular structure, and it is surrounded from outside by a very tough capsule and surrounds the neck or the lower part of the urinary bladder and the beginning of the urethra. It is conical in shape and it resembles an inverted cone. So its parts are base, apex, and 4 surfaces. And also it secretes a secretion which is responsible for nourishment of the sperms. Lastly, the copulatory organ, which is the penis. It is the male copulatory organ, and it is divided into 3 parts. The root at the beginning, the main part is the body, and the terminal part is the glans penis. The glans penis is the last part of the penis, and it is the most sensitive part of it. Now we will come to the female reproductive system. The female reproductive system is the same in structure as the male reproductive system. It is formed firstly of primary sex organ or primary sex gland. Here it is formed by the 2 ovaries, like the primary sex organs in male genital system, which is formed of the 2 testes. So here the ovary also, it has 2 functions. One function of them is the secretory function. Here the ovary secrete the two female hormones, the estrogen and the progesterone. Like the testis, it secretes the testosterone in male. Also, it has another function. As the testis which forms the sperms, here the ovary is responsible for formation of the ova. Number two, the accessory or the secondary organs or female organs, which are formed of what is called the birth canal, which is formed of two parts, the uterus, الرحم, and the vagina, المهبل. And they are considered as the site of development of the fetus till labor. Lastly, the external genital organ or the copulatory organ, which meets the penis during sexual intercourse. Now we will start to study the ovary. As we said before, the ovary is considered as the primary female sex organ or gland. The location or the site of the ovary, it is present in a depression which is present in the lateral wall of the pelvis. Unlike the testis, which is present in a pouch present outside the body in the scrotum. As regards the size of the ovary is 3 by 2 by 1, 3 centimeters in length, 2 centimeters in width, and 1 centimeter thickness, while the testis was 4 by 2 by 1. The shape of the ovary is almond shaped or oval shaped, and the color of it is grayish pink, and it has an outer smooth surface in young females before puberty, but after puberty, due to repeated ovulation, the surface is rough, not smooth. Also, in non-pregnant females, the position of the ovary is vertical or upright, while in previously pregnant females, the position of the ovary is horizontal. And usually, the ovary is present facing one end of the uterine tube or fallopian tube, which is called the fimbriated end of the tube. It is supplied by the ovarian vessels or ovarian arteries, which are branches of the abdominal aorta. Histologically, the ovary is formed of an outer cortex and inner medulla. Now we'll come to the secondary sexual organs, starting with the uterus, الرحم. The uterus is a hollow, thick-walled, muscular organ. Hollow, thick-walled, muscular organ, present in the middle of the pelvis, and anteriorly it is related to the urinary bladder, and posteriorly it is related to the rectum. The shape of the uterus, it is piriform in shape, and it is divided into 3 parts from above downward. The fundus above the body is the middle and the largest part of the uterus, and lower down the cervix, which is similar to a cylindrical tube. The uterus as a whole resembles the funnel, or it is funnel shaped. The upper part, which is the fundus, is the free rounded part or free rounded end of the uterus, and it is convex all around. From all directions, it is convex in shape. The body is the middle part, and it is broad above, and as we come lower down, it becomes more narrow. And it has 2 surfaces, anterior surface and posterior surface. At the site of the junction between the fundus and the body projects the two uterine tubes laterally, while at the junction between the body and the lower part of the uterus, which is the cervix, an area or narrow constriction called the isthmus of the uterus. Number 3, the cervix, or what is called عنق الرحم, is the lower part, and it is tubular in shape, and it is about 1 inch in length and 1 inch in breadth. And the cervix projects lower down in the upper part of the cavity of the vagina, so it is divided into two parts: vaginal part present within the vagina and a part present above the level of the vagina, and we call it the supravaginal part. Here there is the different parts of the uterus. As you see, it is funnel shaped or piriform in shape. The uppermost part is the fundus, followed by the body, and you can see that it is broad above and narrow lower down, and at the junction between the fundus and the body arises the two uterine tubes on either side. Lower down, a tubular structure which is called the cervix, and it is surrounded lower down by the vagina, and the part of the cervix is present within the vagina, which is considered as the vaginal part, and the part above the level of the vagina is the supravaginal part. As regards the dimensions of the uterus, it is 3 by 2 by 1, but in inches, not centimeters. Dimensions of the ovary, 3 by 2 by 1 centimeters, while dimensions of the uterus, 3 by 2 by 1 inches. The position of the uterus as a whole, it is called that it is antiflexed and antiverted. Antiverted part means that the uterus as a whole makes a right angle with the vagina. It is not continuous with each other. The uterus is bent on the vagina, making an angle about 90 degrees, and this angle is called the angle of antiversion. While there is another angle which is present between the body of the uterus and the cervix of the uterus. This angle is called angle of antiflexion. So the position or the normal position of the uterus is antiflexed and antiverted, and the part which is called anti means anteriorly. So the uterus is bent forward on the vagina. This is the angle of antiversion, while the body of the uterus is bent anteriorly on the cervix, and this is the angle of antiflexion. Sometimes there is an abnormal position which is called retroverted and retroflexed uterus. Here the angulation is posterior, not anterior. The blood supply of the uterus comes from the uterine artery, which is a branch from a large artery called the internal iliac artery, which is a branch from the common iliac artery, which is considered as one of the two terminal branches of the aorta. The factors supporting the uterus in position are multiple. Number 1, the ligaments surround the uterus from all directions, help to fix the uterus in position. Also, the surrounding viscera, the bladder from the anterior aspect, while the rectum from the posterior aspect. And also the angulation of the uterus, the antiflexion and the antiversion. Now we'll come to the uterine tubes. The uterine tubes are two tubes arise to the lateral side from the uterus at the area of junction between the fundus and the body. The length of the uterine tube is about 10 centimeters. It has two ends. Medial end, called the uterine end, which opens in the uterine cavity. Lateral end, which is called the peritoneal end, facing the ovary to catch the ova arising from the ovary. The parts of the uterine tube or fallopian tube are four parts from lateral to medial. Number one, the infundibular is the most lateral part, and it resembles a funnel, so it is funnel shaped with projections arise from it like fingers called the fimbriae, which help to catch the ova and direct it toward the cavity of the fallopian tube, then to the uterus itself. Just medially to the infundibulum, there is a part called the ampulla, which is the most dilated part of the fallopian tube, and this is the site where the sperm meets the ovum. Here is the site of fertilization. Thirdly, the isthmus, which is present medial to the ampulla, and it is considered as the narrowest part of the fallopian tube. And lastly, most medially, the intramural part, which is embedded within the wall of the uterus. The last part of the secondary female organ is the vagina. The vagina is considered as a fibromuscular canal, and it represents the female copulatory organ, which meets the male copulatory organs during sexual intercourse and open in the vulva. The site of the vagina is intermediate between the urinary bladder and the urethra anteriorly and the rectum and inner canal posteriorly, and it is directed upward and posterior, making the angle of antiversion between it and the uterus. And since that it is not vertical, so the two walls of it, the anterior and the posterior wall, are not the same in length. The anterior wall is slightly shorter than the posterior wall. The anterior wall is about 7.5 centimeters in length, while the posterior wall is about 9 to 9.5 centimeters in length. And the wall of the vagina is lined by mucosa, which contain glands which secrete mucus secretion, which is rich in glycogen, and due to fermentation, so the medium within the cavity of the vagina is acidic to neutralized with the seminal fluid, because the secretions of the prostate and the seminal vesicle, which are the glands of the male genital system, are alkaline. And this neutralization is very essential to maintain the vitality of the sperms. The vagina leads outside to the vulva, which is considered as the external genital organ of female.